7 Best Exercises for People with Kidney Disease. If you're living with kidney disease or know someone who is, you may be wondering about how to stay active in a way that's both safe and effective. Exercise is a key part of maintaining overall health, but when your kidneys aren't functioning as they should, you need to be extra mindful of your body's limits. Today, we'll be diving into the best exercises for people with kidney disease, why these exercises are particularly suitable, and how often and for how long you should be doing them. We'll also cover some important precautions to keep in mind. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 7. Walking. The first and most basic exercise we're discussing today is walking. It may seem simple, but don't underestimate its power. Walking is one of the safest and easiest exercises for people with kidney disease because it's a low-impact workout. It helps improve cardiovascular health, which is important since people with kidney disease are at higher risk for heart problems. Walking is gentle on the joints and doesn't put excessive strain on the body. It improves circulation and can help reduce blood pressure and blood sugar, which is crucial for managing kidney disease. Regular walks can also help you maintain a healthy weight and reduce stress, easing the strain on your kidneys. A 2013 study found that brisk walking can be as good for your health as running. Just make sure you're walking fast enough that your heart's beating quicker, you're breathing harder, but still able to talk. For most, that's about 2.5 miles per hour or more. As studies suggest, if you put in a mere 30 minutes of brisk walking a day and 5 days a week, you can reduce 19% your risk of coronary heart disease and lower your blood sugar. The American Heart Association, or AHA for short, also recommends 150 minutes a week of moderate intensity aerobic or cardio activity. So aim for 30 minutes of walking 3 to 5 days a week. If that feels like too much, you can start with 10-minute walks and gradually build up to 30 minutes after 1 month. Just don't expect miracles overnight. Consistency is key here. Before your next walk, wear supportive, comfy shoes to protect your joints. Avoid 100% cotton socks since they hold moisture and can cause blisters. Use acrylic or polyester socks instead. Remember to bring water along the way you walk. Listen to your body. If you feel short of breath or dizzy, stop and rest. Avoid walking in extreme weather conditions, such as very hot or cold temperatures. 6. Stretching. Next up, we have stretching, a type of flexibility exercises. These are perfect for improving range of motion, enhancing joint function, and preventing muscle stiffness. Stretching can also be very calming, making it a great way to de-stress, which is especially important for people with kidney disease. Stretching helps loosen up muscles and joints without overexerting the body. You'll experience improved blood flow, vascular function, and bypass stiffness. It's an ideal way to stay limber without straining your kidneys or cardiovascular system. Stretching regularly also helps reduce the risk of injury from other types of exercises. Aim for at least 5 to 10 minutes of gentle stretching every day. You can incorporate stretching into your morning routine or as part of your cool down after walking or other exercises. Also, you can easily find beginner-friendly stretch tutorial videos from professionals on YouTube to follow along with.
So you just start by standing and hold the towel same length as your shoulders and just bring it back.
Begin and end your workouts with stretching, and in between, do aerobic activities like walking or strength training with weights. Mix different activities and focus on different muscle groups each day, such as upper body one day and lower body the next. Remember to be gentle with your stretches. Don't push your body too far or overstretch. It shouldn't hurt. Hold each stretch for about 15 to 30 seconds and avoid bouncing. In stretching, controlling your breath is important. Focus on breathing deeply and slowly to maximize relaxation and flexibility. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Strength training. Low resistance. Strength training might sound intense, but it doesn't have to be. Low-resistance strength training with light weights or resistance bands can be incredibly beneficial for people with kidney disease. Strengthening your muscles helps improve mobility and balance, which is important for preventing falls and injuries. Strength training helps maintain muscle mass, which is often lost when people are dealing with chronic conditions like kidney disease. It also improves bone density and joint health, which can be weakened due to the effects of kidney disease. Building muscle strength supports daily activities and increases overall stamina. Always focus on proper form to avoid injury. Work with a trainer who is familiar with kidney disease if possible to ensure you're using the right techniques. You can aim for 2 sessions per week, targeting major muscle groups like your legs, arms, shoulder, chest, hips, and core. Each session can last about 20 to 30 minutes. If you experience lightheadedness, chest tightness, pain, or can't catch your breath while exercising, stop your activity immediately and consult your health practitioner before resuming. This can help prevent overexertion and its related kidney complications. Also, patients with kidney disease should let their bodies adjust to exercise before adding intensity. Avoid lifting heavy weights, as this can put undue strain on your kidneys. Instead, start with very light weights, about 1 to 3 pounds, or resistance bands, and gradually increase resistance. Once your body becomes comfortable with the activity, you can slowly increase it by varying the frequency, length, and intensity of your exercise. For patients on dialysis, avoid doing static abdominal exercises and exercises that twist your torso. 4. Cycling with stationary bike. Cycling on a stationary bike is another great low-impact exercise for people with kidney disease. It's gentle on your joints, but still provides an excellent cardiovascular workout, which helps improve heart and lung function. Cycling helps strengthen your legs and core while improving endurance without putting too much strain on your body. Since you can control the intensity on a stationary bike, it allows you to tailor the workout to your energy level, which is important for people who may experience fatigue due to kidney disease. Aim for 20 to 30 minutes of cycling 3 times a week at a moderate intensity. You can break this into smaller sessions of 10 to 15 minutes if you're just starting out. Start at a low resistance and gradually increase as you build strength and stamina. If you want to cycle outside instead of on a stationary bike, start with a comfortable distance. Then, each week, add a little more. Your cycling session should feel like a steady, comfortable push. Begin slowly to warm up, then speed up, and finally ease back down as you finish. It's not about speed, it's about going a bit further or longer each time. Over time, you can plan a route with different terrain, including hills, flats, and everything in between. Stay hydrated, but don't overdo it with fluids. Follow your doctor's guidelines on fluid intake. If you get leg cramps, feel dizzy or lightheaded, have a stomachache, or are short of breath, stop immediately and rest. Don't exercise within an hour of going to bed. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Yoga and Pilates. Yoga and Pilates are fantastic for building strength, flexibility, and balance, all while calming your mind. These exercises are particularly beneficial for people with kidney disease because they're low impact and can be modified to suit your energy levels and physical capabilities. Yoga helps improve posture, balance, and breathing, which can be helpful for stress management and improving circulation. Pilates focuses on core strength and flexibility without putting excessive strain on the body. Both forms of exercise are gentle, which is important for those managing chronic kidney disease. If you want to try something new, Tai Chi is a great option. Or if you're able, practice balancing on one leg. You can practice yoga or Pilates 2 to 3 times a week for about 20 to 30 minutes per session. Start with beginner-level classes or guided videos that focus on gentle movements and breathing exercises. Avoid holding your breath during poses and focus on restorative forms of yoga. Avoid poses or movements that require intense twisting or bending if you experience any discomfort in your abdomen or back. Try breaking up your exercise sessions throughout the week to achieve the best results. 2. Water aerobics. Water aerobics, like swimming, are excellent choices for those with kidney disease. These exercises are low impact, helping to strengthen muscles and reduce body fat without overexerting yourself. Water aerobics is particularly beneficial for people with mobility issues or joint pain, as the buoyancy of the water provides natural resistance, supporting your body weight and reducing the impact on joints compared to land exercises. It's a great cardiovascular workout that helps lower blood pressure and improve circulation and endurance while reducing the risk of injury. Aim for 20 to 60 minutes of water aerobics 2 to 5 times per week. If you're just starting out, begin with shorter sessions and gradually build up to longer workouts. But when trying water aerobics, avoid overly warm pools, as heat can increase your heart rate too much. Keep yourself far from contaminated water. Make sure to stay hydrated, as even though you're in the water, your body still loses fluids. If you're on dialysis, consult your doctor before swimming, as there may be specific precautions related to your catheter or fistula. It's better to swim or do aerobic exercises before dialysis or on your non-dialysis days. 1. Deep breathing and relaxation exercises. Lastly, let's not forget about the importance of deep breathing and relaxation exercises. These might not seem like traditional workouts, but they're crucial for managing stress and anxiety, which can have a direct impact on your kidney health. Stress can raise your blood pressure and exacerbate kidney problems. Deep breathing exercises help activate the parasympathetic nervous system, which helps calm the body and mind. This can be especially helpful for those dealing with the mental and emotional challenges of living with kidney disease. In a 2023 study in brain sciences, scientists looked at what makes some breathing techniques more effective than others for reducing stress and anxiety. The successful methods generally did not use only fast breathing or short sessions of less than 5 minutes. They included multiple sessions and regular practice over time. On the other hand, ineffective practices often involved long periods of standing, interruptions, and not enough training for complex techniques. Focus on maintaining good form and breathing steadily throughout each exercise. Using deep breathing and other breathing techniques before training can greatly increase your endurance performance. You can practice deep breathing for 5 to 10 minutes each day, either in the morning to start your day on a calm note or in the evening to wind down before bed. Make sure to breathe deeply and steadily through your nose and exhale fully through your mouth. If you feel lightheaded, stop and take a few moments to breathe normally. People who are on dialysis should avoid forced breathing or the Valsalva maneuver. Conclusion. Exercise is such an important part of staying healthy, especially for those with kidney disease. It helps improve your physical and mental well-being, but it's essential to choose exercises that are safe and suitable for your unique needs. Note that doing strenuous exercise, especially if you don't drink enough water or if it's hot outside, can cause sudden kidney damage, possibly leading to kidney failure in even healthy people. Some of the most common exercises that work for people with kidney disease are walking, cycling, stretching, low-resistance strength training, yogas, Pilates, and deep breathing. Try to make it a daily routine, like eating meals, by exercising at the same time each day. Always consult with your healthcare provider before starting any new workout routine, and remember to listen to your body. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you feel like your kidneys need some extra care due to unhealthy foods and lifestyle choices, check out the video on the screen. Here, we share the top 5 fruits that can help cleanse your kidneys and offer tips to get the most from them. See you there. Stay informed, stay healthy,